Magandang umaga po. Today, we are live on the official Facebook and YouTube pages of the Department of Health. Ako po si Dr. Casey Halili mula sa Public Health Services team. This is our town hall on the prioritization of our A2 and A3 population for COVID-19 vaccination. Welcome po and good morning sa ating mga experts, resource speakers, officers of medical societies, centers for health development, local government, chief executives, hospital administrators, ating mga fellow na doctors, nurses, medtechs, at ang ating mga barangay health workers at vaccination team members. Itong town hall ay naglalayon na ipabatid sa mga local implementers ang kahalagahan ng pagsisiguro ng prioritization ng A2 o mga senior citizens at A3 o mga taong may comorbidities o ibang sakit sa programa ng pagbabakuna ng bansa. Ang pagbabahagi ng tamang impormasyon sa ating mga implementing units ay critical para sa isang united na laban at excellence ng lahat ng ating aksyon sa lahat ng rehiyon sa bansa. Kasama po natin ngayong umaga ang ating mga eksperto upang magbigay linaw sa mga katanungan at agam-agam ng ating mga lolo't lola, mga magulang at kamag-anak na may mga comorbidities o sakit patungkol sa COVID-19 at pagbabakuna. So makakasama po natin ngayong umaga ay ang ating Undersecretary at Spokesperson ng Department of Health, Dr. Maria Rosario Vergeire, ang ating National Vaccine Operations Center Chair, Yusek Mirna Cabotaje, ang Country Representative ng World Health Organization, Dr. Rabindra Abeyangsinge, at ang ating mga eksperto mula sa National Immunization Technical Advisory Group, Dr. Shelly de la Vega at Dr. Minette Rosario. At upang tayo po ay, upang formal na buksan ang ating palatuntunan ngayong umaga, narito po ang OIC Undersecretary ng Public Health Services team at official spokesperson ng Kagawaran ng Kalusugan. Ladies and gentlemen, the Chief Executive Service Officer 2 of the Department of Health, Dr. Maria Rosario Singh Vergeire.
Thank you, Casey. Magandang umaga po sa inyong lahat. Maraming salamat po sa inyo na kasama po namin kayo ngayong araw sa ating town hall na ito. I would like to welcome our representatives from our DOH Centers for Health Development, regional and local vaccination operation centers, and leaders of our local government units. As the entire world continues to struggle against the limited global supply of vaccines, the emergence of the Delta variant has presented another challenge in global efforts to safely overcome the pandemic. With the threat of the Delta variant now in the country, and because of its higher transmissibility, and we are seeing severe cases caused by this variant, there is an urgent need to protect the most high-risk groups from getting infected and experiencing severe and critical symptoms of COVID-19. This results in hospitalization and even deaths. By protecting the most vulnerable groups, we are also seeking to ease the load in our local healthcare systems and decongest our hospitals, thereby securing the capacity of our systems and facilities. If we fail to stop the spread of this Delta variant through early action, we could see our healthcare system potentially collapsing due to catastrophic increase in those needing hospitalization, especially among the unvaccinated high-risk groups like the senior citizens and persons with comorbidities. Let us take the experiences of other countries around the world as a warning. If we do not act together and fast, the Philippines can be in the same devastating situation. 6 months into our COVID-19 vaccination program, we saw how we have increased our coverage among all of our priority groups, even reaching daily job records. However, with the threat of the Delta variant, we have to prioritize senior citizens and the A2 population and those with comorbidities or the A3 population. Based on the latest data we have, 3.3 million fully vaccinated lolos and lolas, and around 4.3 million fully vaccinated persons with comorbidities. These numbers translate to 41% of the master listed A2 population at around 61% for the master listed A3 population. We may have a long way to go, but we are more than determined to increase these numbers. With the help of our local government units, our A2 and A3 population groups will be able to have the vaccines and we can maximize the current supply of our country. Today, we have Dr. Rabindra Abeyasinghe of WHO, Dr. Shelly De La Vega, and Dr. Minette Rosario, our experts from the National Immunization Technical Advisory Group, or the NITAG, who will all discuss the importance of getting priority groups A2 and A3 vaccinated and its importance in our COVID-19 case dynamics. We will also be joined by Undersecretary Mirna C. Cabotaje. She is the chair of our Vaccine Operations Center to answer questions coming from your end and to give the closing remarks. So magandang umaga po sa inyong lahat at maraming salamat po sa pagdalo dito sa pagtitipon na ito. Over to you, Casey.
Thank you po, Yusek. Our first speaker this morning will discuss why we need to prioritize our senior citizens and people with comorbidities in the vaccination drive against COVID-19. He is the country representative of the World Health Organization. Ladies and gentlemen, let's welcome Dr. Rabindra Romal Abeyasinghe.
Magandang umaga and good morning, everybody. Thank you for this opportunity. It's always a pleasure for me to join a town hall and talk about COVID-19 and how we can improve the response in the country. Let me start by commending the good progress in the vaccination of people in the Philippines. 16 million people have been protected through the vaccine rollout, which started in March. And this is incredible progress. We see that 42% of our A2s or elderly population is protected across the country. 63% of our A3s or comorbid populations are protected, and nearly 90% of the healthcare workers are fully protected. Let me start by explaining why it is important that we have a prioritization for the vaccines. Even before the COVID-19 vaccines were actually available, WHO SAGE prepared a prioritization list. This prioritization list was based on the assumption that the vaccines will help reduce primarily the health impact of the COVID-19 pandemic, but also importantly, the economic impact of the pandemic. And in view of this, the SAGE, or the Strategic Advisory Group on Immunization of experts on immunization, recommended a prioritization where we identified different groups that need to be prioritized because it was evident that the world would not be able to produce enough vaccines from the beginning. So going by past experiences, we prepared this prioritization list. And as the COVAX initiative was set up and COVAX distribution started, we requested countries to follow the prioritization because we saw that this was to be the way to maximize the impact of controlling the pandemic. So if we look at the current pandemic in the Philippines, you have more than 1.6 million cases that have been reported and about more than 29,000 deaths that have been reported. This translates to a case fatality rate of about 1.8%. And so it's important for us to look at this data and then understand why it's important to prioritize our elderly and comorbid populations. So as I mentioned, the Philippines, like many other countries in the world, has a case fatality rate of less than 2%. And this is good. But if we break that down and look at the case fatality rate for over 60s, In the Philippines, that's about 8.25%. And if we break that down further and look at the age-specific case fatality rates, the case fatality rate for people between 60 and 69 years is 5.9%. For 70 to 79 years is 10.5%. And over 80s, it's 15.1%. So we see that the case fatality rate increases significantly as the age increases. And this is why it is important for us to prioritize vaccinating elderly and comorbid populations. What do we now have here? If we look at the actual deaths in the Philippines, 64% of the deaths, or about 7 in every 10 deaths, are among people over 60 years of age. If we look at where we are in the progress for vaccination, we have about 42% currently vaccinated. What that translates to is that still out there is a large number of people who have not been vaccinated. In fact, that totals up to nearly 4 million people in the priority group who have not received even one dose of a vaccine yet in the Philippines. And this number of people who have not received one dose significantly varies between regions and LGUs. And we always talk about inequity globally in vaccine access. But we also need to be careful that we are not creating inequity within the country. So we need to ensure that our priority groups across the country have access to the vaccines, because right now, as Yusek Rosette said, we are seeing increasing transmission, not only in the NCR plus regions, we are seeing several other regions that are also experiencing increasing transmission, largely driven by the more transmissible Delta variant. So it is critically important for us to have equitable access for the elderly and the A3s across the country. We see that about 63% of A3s are already fully vaccinated. That's a good thing. So the priority should be on trying to protect the A2s and the A3s. Let me explain why that is necessary. Can we go to the next slide? Yeah, so this is also linked to why it's critically important to protect our elderly, because it's not just about the protecting the elderly, it's also about protecting our economy. For several weeks and months now, we have said that it's important to prioritize the elderly. It's important to protect them, because otherwise they would disproportionately occupy the hospitals, the intensive care units, causing near overwhelming of those facilities. And when that happens, to protect the healthcare system, countries are compelled to go into stringent quarantine measures, implement quarantine measures, which then has implications on economic revival. We explained this many months ago, and we wanted the healthcare workers, the CHDs, the local government institution units, the local chief executives to understand this and prioritize the vaccination of the elderly. Because from the beginning of this pandemic, we know that young people get infected, but young people usually don't end up with severe disease. I'm not saying that they don't develop. A small proportion of them do develop, but the likelihood of them developing severe disease is significantly less than the elderly and the comorbids. So it's important that we use the tools we have to protect those more vulnerable sectors like the healthcare workers, like the elderly, like the comorbid populations, so that we can keep the economy open and minimize the economic harm that the pandemic brings. So we've said this for many months and weeks now, and with the advent of the Delta variant, as it spread across many other countries, in those countries also that did targeted vaccination, covering the elderlies and the comorbids, you see that the cases are surging, the cases are increasing, but the hospitals are not occupied. The ICUs are not occupied, the death rates are not increasing. And this is what we can achieve if we prioritize the elderly and the comorbid populations. That's what we are urging, because if we can do that, we will not need the extensive lockdowns. We will not face economic downturn. So much so that recently one leader called this the pandemic of the unvaccinated, the arrival of Delta. Because if you are vaccinated and if you are fully vaccinated, I need to reiterate that the degree of protection that you have is significantly higher if you are fully vaccinated. So just to make it clear, it's not about giving one dose to as many people as possible. With the arrival of the Delta variant, it's critically important that we protect and fully vaccinate as many people as possible, because a single dose of 2-dose vaccine could leave many people vulnerable. So if we are using a 2-dose schedule, we need to try to ensure that as many people are fully vaccinated so that they benefit from the full protection that the vaccine offers. So let us make use of this opportunity to advocate to our regional and provincial health teams, to our local government units, to our local chief executives, that we need to create avenues to ensure that the senior citizens can access vaccines, either by having priority lanes, by having special days, so that the elderly feel comfortable to go and get the vaccines, or by arranging house-to-house vaccination or mobile vaccination so that that can be arranged. Let me take this a little further. It's not just about protecting the elderly, because sometimes I hear the elderly apparently telling it's more important for the young people to go and get the vaccines. But what happens now with a variant like Delta is that if we don't protect the elderly, we are seeing increasing number of children getting infected. We are seeing the health systems getting full up again. So it's not just about the elderly. If we can vaccinate the elderly, they are also contributing to protect their children and grandchildren. Everybody needs to understand this. It's not about just protecting the elderly. It's the whole of society response that is critically important for us to understand. And if we can do that, then we will be able to manage the increasing transmission, even if it's driven by Delta variant. We will be hopefully able to prevent an overwhelming of the healthcare facilities, and we will end up with less number of deaths and a lesser need for a longer term lockdown. So if we can all understand and agree and work towards this, we will be making the most rational use of the available vaccines, and we will be maximizing the tools that we have in response to the pandemic. So one final word about the Delta variant, because I hear a lot of messaging about concerns about the Delta variant. We know that the Delta variant is about 60% more transmissible. And so large numbers of people are going to get infected. And the larger the number of people who get infected, we know that about 5% of them will develop severe disease. So if your pool of people who are infected is much larger than before, you would expect a much larger proportion of people to develop severe disease. Now, we can reduce that number if we have fully vaccinated our elderly and comorbids. So this is the secret that the countries that have used vaccines rationally have achieved, right? They have very large numbers of infections. Their hospitals are not full. Their ICUs are not full. We can also do that. We need to do that because that's about making rational use of the resources we have, the vaccines we have. It's about improving our response. Thank you very much.
Thank you so much, Dr. Rabi. Thank you for giving us the figures that show our seniors and citizens with comorbidities are more vulnerable to severe diseases of COVID-19, but have a smaller and disproportionate portion of vaccination rate. Also, thank you for giving us a whole community approach to ramp up vaccination. At this point, we'd like to recognize some of our regional and local government executives who are here with us today. We have the representatives of DILG Region 6, 10, and Caraga. We also have the Senior Policy Officer of the League of Cities of the Philippines, Ma'am Janelle Rabe, Mayor of Alimodian, Iloilo, Mayor Jeffrey Alonsabe, also the Mayor of Oton, Iloilo, Mayor Karina Flores, Mayor of Burgos, Pangasinan, Mayor Ronald Ngayawan. We also have Chairman Luna G. Gallo of Barangay Avila, Buenavista, Guimaras, and Chairman Paredes of Barangay Guzman, Hesena of Marindureao, Iloilo. With us also is the Assistant Director of the Center for Health Development of Region 4A, Dr. Paula Paz Sidionco. And now, ang atin pong susunod na tatalakayin ay ang panganib ng COVID-19 sa ating mga lolo't lola. Kasama po natin ngayong umaga ay ang ating eksperto mula sa National Immunization Technical Advisory Group o NITAG, Dr. Shelly De La Vega. Dr. Shelly.
Good morning to everyone. Thank you again for inviting me to this town hall. Good morning to everyone from WHO, DOH, and syempre yung ating mga kasamahan sa mga barangay natin at mga LGUs, no? So if you can please allow me to share screen. Yan na po, nakikita nyo na. Dr. Hadibi,
Yes,
can you see my
yes.
screen? Okay, thank you very much. So I was invited to speak on COVID vulnerabilities of senior citizens, yung mga panganib. Bakit ba kailangan bakunahan ang mga senior citizen? Ano ba talaga ang nangyayari pag tumatanda? So ito pong ating disclosure ay ako po ay miyembro ng interim NITAG ng DOH at past president po ako ng Philippine College of Geriatric Medicine and past president of the Philippine Foundation for Vaccination. So we will describe aging and frailty. Narinig niyo yung salitang frailty. Discuss healthy aging and what is the role of the environment and vaccination in our achievement of healthy aging. And I will also discuss the reasons why senior citizens need the COVID vaccine, no? Its risks and benefits. So medyo nadaanan na po ito ni Dr. Rabi ng WHO. Dumadami na po ang ating senior citizens at ito po ay listahan ng distribution of senior citizens by region. Nakikita naman natin na doon sa mga lugar na maraming senior citizen, yan din ang mga lugar kung saan napakadaming na-ospital, napakaraming namamatay, at napakaraming nako-COVID. Kasi alam naman natin na very vulnerable ang senior citizens dyan. Ano? So number 1 dito sa listahan natin ay ang Calabarzon. Mataas din po ang number ng senior citizens sa NCR, no? Ganon din sa Central Luzon, nandyan din ang Western and Central Visayas, at sa Mindanao naman, Davao, ang pinakamaraming senior citizen. So ito po ang sinasabi ko kanina na kung saan po napakaraming senior citizen, doon din napakaraming namamatay at na-hospital. Kaya napaka-importante para sa atin na mabakunahan ang ating senior nang hindi ma-overwhelm ang ating health system, lalong-lalo na sa mga lugar na ito. No? Pero ngayon, na meron ng nakikita tayong Delta variant, mukhang hindi na lang dito sa mga lugar na ito dumadami. So what is aging? No? Aging really is it's a natural phenomenon. Every one of us will age from the time we are conceived. So lahat po tayo dito sa meeting na ito ay tumatanda. Pero pag tayo ay tumanda, meron po tayong mga challenges sa ating immune system. Yun po ang tawag na immunosenescence. So tumatanda rin po ang immune systems natin, ang mga cells, ang ability natin to mount an immune response, no? Ang ating mga baga hindi na rin magaling magtanggal ng mga virus at bacteria. Kaya kailangan natin ng panlaban diyan, no? Bukod pa doon sa immunosenescence, no? Meron din po tayong mga comorbidities o mga sakit na na-accumulate na natin habang tumatanda. Kasama na po dyan ang mga cardiovascular system problems, yung mga may high blood, may sakit sa puso, may heart failure, respiratory systems, yung chronic obstructive pulmonary disease, lalong-lalo na kapag matagal nang naninigarilyo ang isang matanda. At ang mga itong mga comorbidities na ito ay nakakapagpalala palalo sa komplikasyon at pagkamatay dala ng mga virus gaya ng COVID. Bukod pa doon, ang taong tumatanda po ay may tinatawag na atypical symptoms. Hindi po pangkaraniwan kuminsan ang manifestation ng pneumonia, halimbawa, sapagkat dahil sa tumatanda na ang katawan, kuminsan walang lagnat pero may pneumonia na pala. No? Wala lang ganang kumain, may pneumonia na pala. So early recognition and diagnosis of pneumonia may be missed. No? Akala natin wala namang pneumonia, hindi naman nilalagnat si lolo, hindi naman umuubo si lola, pero malala na pala. So ang outcome because of that, hindi agad nabibigyan ng pansin at lunas, nagiging more severe ang outcome ng mga sakit gaya ng pneumonia. In fact, pag pinag-usapan natin yung isang klaseng pneumonia which is bacterial, yung pneumococcal bacteremia, ang case fatality rate niya among the elderly is 40%. Napakataas po. Oras na pumasok na yung bacteria na yan sa dugo ng isang matanda, kuminsan kahit na anong antibiotic pa ang ibigay natin, talagang mahirap nang gumaling. So kaya po natin nililinaw na kailangan po natin ng panlaban dahil tumatanda na ang katawan ng taong tumatanda. Okay, meron din po tayong naririnig na salitang frailty. Ano frail? Ano ba yan? Ano ba yung frailty na yan? Yung kahinaan ng isang tao, or sa definition ng Association of Gerontology and Geriatrics, frailty consensus, ang sabi is, it is a reduced strength and physiologic malfunctioning that increases an individual's susceptibility to increased dependency, vulnerability, and death. So tayo, habang bata pa tayo ay rabas, no? Matipuno, malakas, no? Magaling tayong manlaban ng mga stress sa ating katawan. Nakaka-recover tayo agad pag may sakit tayo. Pero habang tumatanda, meron tayong mga sakit, mga comorbidities, may mga maging bisyo tayo na nakakapanghina sa ating katawan once na magkaroon tayo ng sakit, no? Or stressor, gaya ng, let's say, pneumonia, na nahihirapan nang mag-recover ang katawan natin. So nandito na sa pre-frailty ang karamihan sa mga senior citizen dahil sa aming pag-aaral, nandito pala ang karamihan ng mga Pilipino. So pagka pre-frail ka na senior citizen at tamaan ka pa ng COVID, ayan na, mas madali ka nang maging frail. At anong ibig sabihin ng frail? Baka maging disabled ka na, baka kailangan mo na ng caregiver, naka-wheelchair ka na, baka nga ikamatay mo pa. So ang kondisyon ng frailty ay totoo sapagkat ito ay kailangan nating labanan para hindi naman tayo masyadong manghina, no? Tandaan po ninyo na ang frailty, gaya din ng pre-frailty, ay maaring malampasan o ma-reverse, no? Nandito po, importante yung mga bagay na sistema sa ating pangangalaga sa sarili, ang sistema ng pagbibigay ng bakuna, kunwari, ang health program, ang environmental support, family support. Napaka-importante po niyan para hindi tayo maging frail. At kung pre-frail man, maaari tayong maging robust ulit. At kung frail, maaari pa rin tayong lumakas at maging pre-frail. So ito po ay reversible. So, senior citizens no doubt are at risk of severe COVID. That was what Dr. Abhay Singhe or Dr. Rabi of WHO had emphasized in his earlier talk. Most deaths are among older persons, and that death rate goes up higher as the person ages, especially kung beyond 80 years old. Hindi na po natin yan mapagkakaila, no? At ang dahilan, gaya ng sinabi ko kanina, ay hindi lang dahil sa edad at immunosenescence, kundi dahil dumadami rin ang mga comorbidity habang tumatanda ang Pilipino. Sa isang pag-aaral po namin sa Institute on Aging, na tinatawag na Fit for Frail, na pinondohan po ng DOH, napag-alaman po namin na 55.6% ng senior citizens na naging participant namin, 55.6% o mahigit sa kalahati ang may high blood, 16.8% ang may diabetes, 15.4% ang obese. Alam naman natin itong tatlo na to, hypertension, diabetes, obesity, ito po yung mga talagang nakakapanghina pag may COVID. At marami rin po, 11% po halos ng mga kalalakihan ay naninigarilyo pa. So humihina ang kanilang baga. At napaka-importante pong malaman natin na 4.2% po ay living alone or nag-iisa lang. Dito po sa panahon ng COVID, napakarami na po nating naririnig na kwento na ang isang matanda na nag-iisa lang sa bahay ay natagpuan na lang na nakadapa at patay na. Patay na po nung natagpuan dahil mag-isa lang siya. No, yun po ay napakatinding vulnerability. 4.2%, mabuti naman at konti lang sila. Pero kahit na po, kayo pong nasa barangay, kailangan alam nyo po yun. Sino po sa mga kasamahan nyo sa barangay ang mag-isa lang at walang kasama, no? Dependency, yan din po sa primary caregiver is a marker of frailty. At alam natin na ang mga frail ay mas may tendency na magka-COVID at complications, no? 44.2% of those aged 80 years and older in our study needed a primary caregiver. Sa makatuwid, sila po yung mga frail. No? Ngayon, isa pa po sa pinanganganiban, parang pinangangambahan ng mga senior citizen ay hindi lang yung magkasakit sa COVID at ma-ospital, kundi itong komplikasyon na tinatawag na natin ngayon na long COVID. Kasi kahit na natapos na yung COVID, no, dadating pa rin ang ilang buwan, tatagal pa rin ang mga simptomas mo. Kung minsan, kalahating taon, meron ka pa rin long COVID symptoms. At yun ay nakakapanghina talaga, nakakapagpa-frail sa mga seniors. So ano po ba itong mga ito? Meron pong psychological at merong physical. So dahil po ako ay geriatrician, meron po akong mga pasyente na encounter na ito po ang kanilang pinagdadaanan ngayon. Siyempre, kapag ikaw ay senior citizen at namatayan ka ng asawa or anak or kaibigan, ay mga kaibigan mong mga tatanda ay namamatay ng lahat, nakakalungkot po yun. So marami po akong mga pasyente na may grief or aggravated grief and bereavement. Meron din po mga nade-depress na po talaga, no? Meron din po mga post-traumatic stress disorder. Dahil po sila ay na-ospital, nakabitan ng tubo, nakabitan ng maraming gamot at sinusok ng maraming beses dahil sa kanyang pagkakasakit, dahil sa kailangan ng mga gamot at blood test. Nasa stress po sila pagkatapos po nilang ma-discharge sa ospital, naaalala nila yun. Na para bang may gera, parang hindi po ba yung post-traumatic stress disorder, naririnig po natin yun dun sa mga natapos ng lumaban sa gera. Pero parang gera pala ang COVID. So na bumabalik sa kaisipan nila yung experience nila ng pagkakatinding COVID sa ICU. Ngayon, dahil sa mga naranasan nila, hindi na rin makatulog. Meron na rin mga insomnia, no? At yung poor memory, humihina rin po ang pag-iisip kahit paano, yung brain fog, Meron po ako mga pasyente na gano'n, parang bumagal po ang pag-iisip. Wala naman silang dementia, no? Wala naman silang Alzheimer's, pero bumagal po talaga ang pag-iisip nila pagkatapos ng COVID. Physically, syempre po dahil mahina na rin ang katawan, yung panghina ng paghinga, yung shortness of breath, fatigue, joint pains, poor mobility, poor appetite, at saka headache, kuminsan po tumatagal ng matagal pa sa 3 buwan. No? So, yun po ang long COVID. Ngayon, ang vulnerability po ng isang matanda ay hindi lang dahil sa kanyang immune system at saka comorbidity. Meron din po mga vulnerabilities na nangyayari sa environment natin ngayon, no? Sa kapaligiran natin ngayon na na-aggravate at pinalala ng COVID. Ano po ito? Ang pagkawala po ng social support, no? Yun po ay isang nakakapagpalala sa sitwasyon ng senior citizen gaya ng ageism. Kasi kuminsan, iniisip ng mga tao, ay matanda na yan, wag na natin padala sa ospital, mamatay na lang sa bahay, o kaya matanda na yan, wag na nating bakunahan. Hindi na yan gagaling anyway. Hindi po yun maganda at ang tawag po doon talaga ay ageism, no? Huwag po tayong magpadala sa mga ganon na sinasabi ng mga tao na kunwari ay dahil lang sa pagtanda mo ay hindi mo na kayang gumaling. Violence and abuse. Dahil mahirap po ang sitwasyon sa mga bahay at walang mga trabaho ang mga anak, kuminsan ang mga senior citizen ay prone ngayon sa financial abuse, verbal and emotional abuse, no? Bukod pa sa physical abuse. Low education and literacy, lalo na yung low technology literacy. Kasi marami po sa mga kailangan ngayon ay kailangan marunong ka sa laptop o kaya sa cellphone, mag-schedule ng bakuna mo sa cellphone, magparehistro, sa internet, ginagawa pong lahat yun. At marami sa mga senior citizen natin ay hindi marunong nun sa technology na yon. Yung lockdown po mismo, yung hindi pwedeng lumabas sa bahay ay nakakapanghina na rin, no? Lalo silang na-isolate at pag na-isolate po sila, hindi sila nakakapag-participate sa mga bagay na dati nilang gustong gawin. So sila ay lubhang nalulungkot. Bukod pa doon, hindi sila makapaglakad. So nangihina po ang mga muscle, no? Lalong nagiging kuba. Ang mga kalamnan ay sumasakit lagi dahil dyan sa isolation na yan. And poor accessibility to health and vaccine centers. Nung nag-uumpisa pa lang po tayong magpalabas ng bakuna, meron po mga center talaga na malayo sa tinitirhan ng kanilang ng matatanda at hindi po nila mapuntahan yon. Pero ngayon, alam ko marami na sa mga LGU ay may mga vaccination centers na andun na malapit sa barangay at lalong-lalo na nabibisita na po yung mga hindi talaga kayang maglakad papuntang vaccine center. So yung home vaccination, salamat po sa inyong pag-approve dyan sa panukala ng home vaccination. So, and of course, the lack of safe spaces to walk and be active. So yung kawalan ng mga park, kawalan ng lakaran na maaliwala sa labas ng bahay, nakakapangpahina din po yan sa mga senior citizen. Ano po? Kailangan po ng mga ganung mga lugar. Okay. So, ano po ba yung healthy aging? Kasi po, naandito na tayo sa decade of healthy aging eh. Matatapos din po ang COVID na ito. Awa ng Diyos, matatapos na rin po. Pero kailangan po natin panatiliin pa rin ang healthy aging natin. No? At ang healthy aging ay ang proseso, the process of development and maintaining the functional ability that enables well-being in older age. Ibig sabihin po nito, ang healthy aging po para ating maatim, ay maaari tayong mag-function o maaari nating gawin ang mga bagay na may makahulugan at importante para sa ating well-being. Ito yung mga nagpapalakas ng loob sa atin dahil ito yung importante sa ating pagtanda. So hindi lang po siya physical, no? Physical, mental well-being po, napaka-importante. Spiritual well-being, napaka-importante po. This is what healthy aging is all about. It starts from the womb and ends in the tomb just as aging is. So healthy aging po tayo habang tumatanda, pamula bata hanggang pagtanda. So very important po kasi yung interaction ng sarili nating katawan sa ating environment, no? Kung tayo ay mahina pero may suporta naman ang sistema natin para sa mga mahina ang katawan, para sa mga disabled, kaya pa rin nating gampanan kung ano ang importante sa atin. Yun po ang healthy aging. So, tignan po natin itong trajectory. Meron pong blue line at may red line. Kadalasan po, ang isang taong tumatanda, no, na walang suporta, yung sarili lang niyang pagtanda, pag tinignan natin ang biological aging, dito sa baba, biological aging habang tumatanda, ang function naman dito sa kaliwa, ito pong blue line, habang tumatanda ang tao, ang kanyang functional ability talaga namang humihina. Totoo naman po yun habang tumatanda. Ngunit, kapag meron tayong suporta galing sa ating environment, meron tayong social support, healthcare support, etc., ang ating kapasidad po sa panghihina po ay na-maintain natin, no? Na-maintain natin. Kumpara natin dito, kunwari sa isang tao, itong red line na COVID, biglang lumalala na ngayon ang kanyang function, di ba? Kasi merong parang dagok sa kanyang health, no? At biglang lumala ang function niya. Kapag gusto natin itong blue line, kailangan po natin talaga dito, no? Ang kaibahan nitong red sa blue line ay ang support system po natin, kasama na ang vaccination, no? Na sinasabi natin at pinag-uusapan ngayon. Okay. So healthy aging, how do we improve our intrinsic capacity, no? We improve our intrinsic capacity by reducing non-communicable diseases such as hypertension, diabetes, cancer, lung disease, kidney disease, etc. And very important here is primary and secondary prevention. Ito po ay kasakop na ngayon ng ating universal healthcare. So, ang healthy aging primary prevention po ay kadalasan ay lifestyle. Wala ka pang sakit, ayaw mo magkasakit, kailangan mo ng healthy lifestyle. Fitness or exercise, movement, healthy nutrition, stop smoking, at iwasan or bawasan ang pag-inom ng alak. Yan po ang napaka-importante sa ating primary prevention for healthy aging. Pero, napaka-importante po ng vaccination. It is the only parang drug that is part of our healthy aging program in primary prevention. So let's not, sabi nga natin, prevention is better than cure and vaccination is better than having COVID and all of those medicines, no? That are necessary to get you better. Okay, so secondary, so bakit po beneficial ulit ang vaccination sa senior citizen? Because it reduces the risk of disease. It reduces complications and death. And para sa matanda, it allows you to continue to work, to do things that are meaningful. Kahit kunyari sa bahay, ikaw ay nag-aalaga ng kapamilya mo, ikaw ay nagluluto, or may trabaho ka pa rin. No? Meron kang negosyo, pumapasok ka pa rin sa office, no? It allows you to continue to work. It also protects others around you. Hindi lang ikaw na senior citizen, pero yung mga kasamahan mo sa bahay, protektado din. At it allows you to attain healthy aging. Iniiwasan mo yung long COVID. Kasi kapag tinamaan ka na ng long COVID, yung number of months and maybe years mo after that, medyo mahina ka na. Ayaw mo yon. Gusto mo ng healthy aging. Okay. So ito na po. So kapag ikaw ay gustong mag-maintain ng inyong functional ability for as long as possible, andyan na po ang COVID vaccination because it will allow you really to avoid the declines in your function due to COVID complications. Okay? So pero ito po ay kailangan nating pag-usapan po kasi marami po tayong mga naririnig na hindi pa nagpapabakuna or hindi kayang magpabakuna, ayaw magpabakuna. So ito po yung mga pag-aaral na ginawa namin, may mga kasama tayo sa DOH at saka sa Institute on Aging, sa mga ibang sectors na nagsama-sama po kami para pag-usapan ito. Ang mga obstacles po to COVID vaccination among senior citizens, no, is number one, lack of trust in vaccine safety and efficacy. Marami po kasi dyan lumalabas ng mga fake news, mga conspiracy theories na pinapalabas, no? At saka kuminsan, yung anak mismo ang ayaw. Ayaw ng anak kasi hindi naiintindihan ng anak kung ano ang ibig sabihin ng bakuna. Akala ng anak, ang bakuna ay para sa bata lang. Hindi na po. No? Matagal na tayong nagpapabakuna ng ating senior citizen laban sa pneumonia at flu. Ngayon naman ay laban sa COVID, importante po. So ayaw natin yung tinatawag na ageism, itong nasa mga salita na ito binibigkas ng mga tao pagka may ageism sila. Ang matanda, forgetful na yan. Mga biktima lang yan, no? Burden, they are burden to our family and to society. So, mas mainam siguro, mamatay na lang, wag na lang nating pansinin that they are useless, di ba? That they are helpless, that they are weak. Ayaw po natin yan kasi these are drivers to poor healthcare access and these are obstacles to COVID vaccination. Meron din po mga pangilan-ngilan na takot sa karayom na wala na po tayong magagawa doon. Sana po, at meron naman silang iniimbento ngayon ng mga bakuna na wala ng karayom. Sana nga. No? Meron din po ilang mga doktor na sabi masyado nang mahina na wag na natin bakunahan. So, yun po ang mga ibang mga dahilan. No? Kaya't hindi nababakunahan pa ang maraming senior citizen. Okay. Pero ang tanong po natin, balikan natin, ang mga senior citizen po ba talaga ay masyado nang mahina? Are senior citizens too frail and weak for the COVID vaccine? And again, I'm going back to the Fit for Frail study data that was funded by DOH. No? The frailest, no doubt, are at the highest risk for COVID complications. In our study, 355 participants in 4 regions in the country, only 15% lang po, 15% lang po ang frail. No? Greater majority were not frail. Tandaan po nyo yun. 19.3% were robust and 60.5% were pre-frail. Yung 60.5% po na pre-frail na yun at mga frail din, yun po ang napaka-importanting mabakunahan. Siyempre, pati yung robust, dapat lahat. No? Pero tandaan po natin, hindi po mahina ang mga senior citizen. Gusto po natin silang manatiling malakas, kaya kailangan po silang mabakunahan. Okay, so pumunta naman po tayo sa secondary prevention, which is also important in healthy aging. Gaya ng sabi ko, matatapos rin po ang COVID. Kailangan po natin ipagpatuloy ang pagsugpo ng non-communicable disease, inumin ang inyong maintenance medicine pag meron. Kapag masyadong mataba, kailangan talagang medyo magpapayat, no? Alam naman natin ang COVID, gustong-gusto niya yung mga obese. At magpakonsulta po sa inyong doktor hanggat maaari. Meron naman na po ngayong mga teleconsultation. May mga ibang clinic na bukas naman po para sa mga senior citizen. No? At home care, meron din po mga geriatrician na dumadalaw sa mga bahay para check-upin ang mga seniors. No? So, this is the decade of healthy aging, 2020 to 2030. Dineclare na po yan ng UN and WHO. And we need to look at our environment to make it age-friendly. No? So, what are these? Social support. Because we want to get rid of social isolation. We want to support, dalawin po natin ng mga senior citizen, alamin natin kung anong pangangailangan nila. We need them to be protected from violence and abuse. Continue education, especially literacy in the internet, for example. Allow them to participate as volunteers and mentors. No, we need to change the environment to make things more accessible to them. No, and therefore we also need our partners in the Department of Transportation, our engineers, our architects, etc., and planners, city planners, so that we have spaces to walk and be active as we age. Okay? So finally, ito po ang sasabihin ko, COVID vaccination is recommended for senior citizens. Especially if you have comorbidities, no? Mas lalo nyo pang kailangan yan. And COVID vaccines are generally safe. And the most effective brands of senior citizens are what we are recommending to you. Okay? So wag po kayong turn away ng senior citizen dahil walang medical clearance. Halos wala pong senior citizen, halos lahat po ng senior citizen ay hindi naman kailangan ng medical clearance. Kailangan lang nila ng senior citizen card at isang magaling na barangay coordinator po talaga kailangan natin para mabakunahan ng inyong mga senior citizen. Ano po? Okay? The best protection against COVID, dapat face mask, face shield, hand washing, physical distancing, air circulation and ventilation, and limit interaction to 30 minutes. Vaccination, always important, and let's always remember healthy aging. Thank you po sa inyong lahat.
Thank you so much, Doc Shelly. Salamat po at nakaka-encourage naman yung sinabi niyo na from your studies, ang mga lolo't lola natin, hindi sila generally mahina. At may pag-asa pa na makapag-healthy aging o mapaganda pa yung kalusugan nila. Pero binanggit niyo rin po ang mga vulnerabilities na meron sila, like sa environmental, physical, emotional, na mga maaari ring maging obstacle, maliban po dun sa iba po ninyong sinabi na obstacles na ngayon, hopefully ang mga LGUs po natin, itong mga vaccination sites at mga barangay health workers natin, magagamit po nila ito para malaman nila kung paano pa nila mapapalapit ang bakuna sa ating mga lolo't lola.
Tama.
Salamat po again.
Salamat
Dr.
din.
At ngayon po, i-recognize lang din po natin uli ang mga kasama natin dito sa ating meeting. External Partnerships Manager ng Union of Local Authorities of the Philippines, Ma'am Miriam Padua. Mula sa Zaraga, Iloilo, Mayor John Tarosa. From Veruela, Agusan del Sur, Mayor Mirna Mondejar. From Gonzaga, Cagayan Valley, Mayor Marilyn Pentecostes. At iba pa pong mga local medical health officers, barangay health workers or BHERTs, kagawads, DRRMOs, vaccine coordinators, HEPOs, information officers ng iba't iba pong LGU nandito rin. Kasama rin po natin si Dr. Cesar Cascion ng CHD ng Caraga, at Health Education Promotion Officers and Communications Management Unit personnel ng ating mga CHDs. Salamat po for being with us today and partnering with us para po sa pagbabakuna ng ating mga lolo't lola at ng mga A3. Ang atin naman pong susunod na tatalakayin at pag-uusapan ay ang iba't ibang sakit na at ang kanilang epekto sa mga taong magpopositibo sa COVID-19. So kasama po natin, isa rin pong eksperto mula sa NITAG, si Dr. Minette Rosario. Dr. Minette, good morning po.
Good morning. Good morning po sa lahat ng participants sa town hall meeting, all members of DOH and Dr. Rabi of WHO. I-share lang po ako ng screen. Okay. This morning po is about comorbidities and its impact on COVID-19. Dr. Shelly De La Vega, napasimple with all the information she provided us clearly, napasimple po niya yung mangyayaring pagtatalakay ko dito sa mga may comorbidities. Wala po akong conflicts of interest for this activity. Tuloy na po tayo sa mga comorbidities. May ilan po akong babanggitin. Ang heart conditions po ay yung mga pasyente ang may karamdaman sa puso ay yung mga may heart failure, coronary artery disease, ibig sabihin may bara po yung daanan ng ugat na nagsusupply doon sa ating puso. Cardiomyopathy, yan po yung mga may kondisyon na nanghina po ang muscle mismo ng heart, or yung mga may hypertension or matataas ang blood pressure. More likely to get severe form of COVID-19 po sila. Okay. Sino naman yung mga may chronic lung disease? Ito po yung mga may lung cancer, chronic obstructive pulmonary disease. Ito po yung mga nasasabing merong bronchitis, merong emphysema, o kaya meron din silang mga bronchiectasis, pagkakasira po nung mismong daanan ng hangin, kaya ubo ng ubo, may plema ng tuloy-tuloy. Meron pong cystic fibrosis and pulmonary fibrosis at pulmonary hypertension. So itong sa chronic lung disease, ito yung mga pasyente na sinasabi yung may structural change na po, may pagkakaiba na dun sa struktura ng ating baga at mga daanan ng hangin, na maliban sa struktura, nabanggit na po ni Dr. Shelley na yung immune system bumaba na. So maliban sa anatomy, yung physiology, yung function mismo, na iiba na rin. Kaya, meron din silang increased risk ng COVID-19 complications. Sino naman itong mga immunocompromised or yung mga sinasabing mababa ang immune system? Ito po yung mga pasyente na sinasabing cell counts mababa, katulad ng mga tumatanggap po ng steroids or yung mga tumatanggap po ng chemotherapy para sa kanilang cancer. Some patients with HIV have low CD4 counts. O kaya yung mga pasyente din naman po na merong rheumatologic problem, yung mga lupus po yan, or other connective tissue diseases, tumatanggap din po sila ng gamot para pababain ang immune system. Importante pong nababakunahan sila dahil hindi nila makakayanan. Una, hindi natin alam sa ngayon ano ang bisa ng bakuna sa kanila. Pangalawa, mas mahirap na. Parang doble yung paghihirap ng kanilang immune system doon sa panglaban sa kahit anong infeksyon kasama na rin ang COVID. Yung mga may cancer of history of cancer, meron ding risk of developing severe complications from COVID. Okay? Treatments from many types of cancer can weaken the body's ability to fight off disease. Nabanggit ko po yan dun sa earlier slide regarding yung immune-compromised patients. Yung mga diabetic patients naman po, higher chance of contracting COVID-19 and its severe symptoms due to impaired phagocytic cell capabilities. Ano ibig sabihin nito? Sa pinakasimple, kunwari, nagpapagawa tayo ng CBC, yung mga diabetic natin na kamag-anak. Sabihin, ay normal naman yung white blood cell count ko sa CBC ko. Yung mga ganyang sitwasyon, diabetic nga sila, normal ang WBC count. Okay? Pero yung function or yung kakayahan and ability ng selyo na para lumaban, wala na siya doon. Lalo na kung hindi maganda yung level ng mga blood sugar control na nakikita sa pasyente. So kahit na sabihin nating normal, walang bisa halos. Kaya technically, secondary immune compromised state po itong pagkakaroon ng diabetes. Yung naman may mga kondisyon sa atay. So, merong almost 7,000 people na may kondisyon sa atay, COVID-19. Meron po silang, parang 1/3 of these patients nag-positive po sila. Tapos, 2/3 naman sa kanila nangailangan po ng papa-hospital dahil lang sa COVID. Tapos ito yung mga chronic kidney disorders, ito po yung mga pasyente mahina na ang kondisyon sa bato, not necessarily ang pinag-uusapan ay yung mga nagda-dialysis lang. Okay? So ito yung mga pababa na po yung trend or yung mga sinasabing may renal insufficiency na po. Okay. Sa National COVID-19 Vaccine Deployment Program, ang gusto po natin is safe, equitable, and cost-effective immunization for all Filipinos. Ang primary goal po natin ay direct reduction of morbidity and mortality and maintenance of the most critical essential services. Secondary goal po natin, control po ng transmission, lalo na ngayon na meron tayong Delta variant, and then minimize disruption of social, economic, and security functions. Nabanggit na rin po ito ni Dr. Rabi. Doon sa mga merong A3 or comorbidities, ito po yung bilang ng mga merong presentasyon ng asymptomatic, mild, moderate, severe, at critical. Ito po yung spectrum or severity classifications. Makikita din po natin dito na 58% nag-recover, pero tingnan nyo din po yung namatay. Nasa 40% or 41% halos yan. Hindi po yan magandang bilang. Tapos ito pong mga deaths among A3 confirmed cases. Initially, in his talk, Dr. Rabi mentioned yung mga deaths or case fatality rate among those who are elderly, no? Pero ito, ang pinag-uusapan natin, isipin nyo yung parang kita-kita, may gitna po yan yung mga elderly at saka may comorbidities. So yung mga values ng case fatality rates dito ay mas mataas kaysa yung unang nabanggit ni Dr. Rabi. Makikita nyo dito na pataas ng pataas yung age group, more likely mas marami ng comorbidities, yung mga elderly population, ang taas na rin po ng case fatality rate. Kaya nga po, ang ini-emphasize ng ating vaccination program ay ang prioritization ng senior citizens at saka nung merong mga comorbidities. Para po mababaan natin ang pagkakasakit at pagkakamatay po ng mga individuals po na ito. Ito mong data ay galing sa NVOC Bulletin number 158. Pinapakita ko lang po at i-emphasize ko lang dito na meron tayo sa iba't ibang rehiyon yung estimated priority group A3. So makikita natin dito, aabot tayo ng 7.1 million. Pwedeng mas mataas pa nga or yun, parang baka kulang pa nga tong bilang na to, pero ang gusto nating mangyari at 60% overall coverage ng fully vaccinated, ibig sabihin, 2 linggo po ang nakaraan at nakatanggap na sila ng 2 doses at kung 2 doses po ang bakuna or 2 linggo na po ang nakaraan doon sa dose po nila ng Janssen vaccine na iisang dose lang po ang kailangan. Gusto natin ng mas mataas pa na overall coverage para dun sa fully vaccinated. Okay. Sa 2 reference po na nakikita nyo dito, ang sinasabi po nila, so meta-analysis, ibig sabihin, pinulong-pulong po nila yung maraming pag-aaral tungkol dun sa COVID-19 at saka yung mga merong comorbid conditions. At nakita po talaga na ang cardiovascular disease, cerebrovascular disease, yung mga nagsustroke, yung mga may high blood, may diabetes, chronic kidney at COPD, ang mga merong matitinding kurso or increased worse clinical outcomes and even death po sa mga pasyente na to. 2 lang po ito sa at least 5 reference na nagsasabing comorbid conditions po ang mga dapat i-prioritize para protektahan laban sa COVID. At ano naman ang relasyon ni COVID-19 variant, lalo na si Delta? Most of the studies po, ang sasabihin si Delta variant, highly transmissible. Tapos, can strain our healthcare system. Bakit? I-share ko sa inyo yung karanasan ng tumitingin po ng COVID patients sa ospital, no? Yung last year, wala pa tayong mga Delta or iba pang variant na kikinita na namin kung ano po yung kurso ng sakit eh. Nape-predict na namin kung itong araw na to, ito ang mangyayari. Parang ganun po. Ngayon po nun sa Delta variant, maliban po sa transmissibility, yung kurso ng pasyente sa ospital mas matagal. Okay? Kaya may strain sa healthcare system. So matagal na nga siya, kakaiba na yung presentasyon, yung number of days na binibilang namin, parang hindi na niya sinusunod eh. Lalong tumatagal yung pasyente sa ospital, yung mga dapat na-admit, hindi po na-admit kasi puno pa yung ospital. So yung care na apektuhan, para siyang domino. So yun po yung gusto namin emphasize kung bakit napaka-importante na mabakunahan natin yung mga pasyente. Meron din pong sa mga ospital, meron din pong mga pagtatala or minomonitor po kung sino-sino po ba yung mga pasyente na nabakunahan, na fully vaccinated, partially vaccinated. Tinitingnan ano yung kurso nung kondisyon nila dahil dun sa vaccination status. So gusto natin yung makita at ang nakikita po namin at least dun sa ospital na kung saan po ako nagtatrabaho ay nakikita namin na yung non-healthcare worker na walang bakuna, mas madami po sa kanila, almost 50% po sa kanila severe and critical, tapos mas marami pong namamatay. Okay? So ang gusto po namin na mensahe, gawin nating madali para mabakunahan po ang A2 and A3, sundan po natin ang minimum public health standards, pag-isahin po natin ang mensahe na dapat magpabakuna, safe at effective ang bakuna. Thank you po.
Thank you, Dr. Minette, para sa pagde-delineate po, no, paglista ng mga iba't ibang epekto at iba't ibang sakit po na pwedeng magpalala pa ng COVID-19. At salamat din po kasi what you said, tama, dapat pag-isahin ang mensahe mula po from DOH, pati sa LGU, sa vaccination sites at bawat barangay. Kailangan isa lang po ang mensahe natin na ang mga bakuna natin ay safe at nakakaprotekta para sa matatanda at para sa mga taong may mga pre-existing na condition o sakit. Yan. So, ngayon po tayo ay dadako sa ating open forum. Simulan So, nandito naman po ang ating mga eksperto. Dr. Rabi is still here. If I'm not sure if Dr. Mirna is also here para po sa mga katanungan din for sa pagbabakuna and strategies. So, one of our questions and comments po, how do we strategize the vaccination of the A2 and A3 considering the availability of vaccine supplies and their willingness to undergo the vaccination?
May I answer,
Sige.
Lindsay?
Yes po, Dr. Mirna.
Thank you. Kagaya nung sabi ng previous speakers, no, we have a master list of eligible senior citizen. And ito ay nagmamatch sa data ng ating NEDA. So yung master list, galing sa kanila yun. So this is equalizing. Ang pagbigay natin ng pagbabakuna, first was based on prioritization. So, binigay natin yung mga health workers. So, tinignan natin ilan ang listahan ng health workers, tinutuloy. Pangalawa, yung allocation ngayon ay based on the number of senior citizens that are listed in the different areas. To date, I will say that many have already been given enough for their senior citizen. Kaya lang, we will need to really look at why are they not vaccinating. Ang napakalaking equalizing factor natin, when we gave the J&J, no? So this was from COVAX, we really prioritize A2. And the regions have responded, and this caused the increase in the vaccination of the senior citizens. But we need to continue advocating and really looking out sino na ba ang hindi nabakunahan. MMDA, the NCR mayors will say that many of them have really gone around and ramped up. So meron pang hindi nabibigyan. So it's a question of supply, but we are trying to give the supply, prioritizing, especially from COVAX, yung senior citizen. And then we need to strategize so that we are able to reach all the senior citizens so that they become vaccinated. I don't know if it was mentioned here. We are also looking at the strategy recommended, yung A2+1 and A3+1 strategy. So the senior citizen or the ones with comorbidities, there are certain classification of comorbidities. If they are brought to the health center, pwede nang bakunahan yung nagdala sa kanila ng household member, and they do not have to queue or line up. They have priority lists.
Salamat po, Yusek Mirna. So, ayun nga po, ang maliban sa supply, no, kaya ang ating strategy for A2 and A3, yung mga mobile vaccination natin, at ito pong masisimulan na A2+1 at A3+1 para hindi lang po, syempre ang lolo't lola ang nababakunahan, pati po yung mga kasama nila sa bahay. Ang susunod po natin ay a comment po ito from our Zoom. I totally agree with the WHO that the elderly and those with comorbidity should be prioritized. The categories for prioritization should be followed. And our next question, how long would it take for senior citizens to be vaccinated if they have been tested positive? So, Yusek Rosette?
Yes, Casey, I suggest that you call on our specific experts for specific questions so that we are guided. So this can be answered by Dr. Minette Rosario or Dr. Shelly De La Vega.
Ako na lang, Dr. Casey.
Sige pa, Dr. Minette.
Okay. Not only for senior citizens, no. patients who develop COVID, meron tayong susundan na recovery criteria at saka yung isolation criteria. So dun sa moderate, severe, critical, senior citizen man po sila or hindi. Tapusin nila yung criteria, 21 days plus meron dapat po silang symptom-free. Ibig sabihin, talagang nakita natin na yung dahilan ng pinagka-hospital nila ay nag-resolve, no? Tapos yung 21 days kasama siya doon. For patients, pwede nyo pong i-certify na can immediately receive vaccination, okay, upon completion of recovery or isolation criteria.
Salamat po, Dr. Minette. So, ayun po, basta natapos na ang isolation period at wala ng simptomas, pwede na pong magpabakuna ang mga senior citizens natin. Another question po for Dr. Minette. Are all the available vaccines safe for patients with autoimmune diseases and immune deficiency syndromes?
Yung sa mga immunodeficiency states, ang pinaka-importante po dyan, kaya po nagre-request tayo ng medical clearance. Kasi importante yung timing eh. Kung may tinatanggap silang immunosuppressive na drug, yung bisa ng bakuna baka lalo pang bumaba. So yun yung kailangan na makuha natin na impormasyon. Yung tanong na safe ba, sa mga pagsusuri kasi or studies doon sa mga vaccines, konti lang yung naisasama doon sa mga immunocompromised state. Pero doon sa mga naisama, safe naman po yung bakuna, tsaka effective. Pero yung effectiveness nga, nakikita nila hindi kasing taas nung naibabalita po para in comparison doon sa mga wala pong comorbidities.
Okay, thank you po. The next question for Dr. Minette and Doc Shelley, pwede po rin mag-rejoinder. Ask ko lang po, ang pagtatae po ba ay isa rin pong adverse effect ng vaccines? Nag-aalala po kasi ang anak ko simula nung nagpabakuna siya.
Okay, I will try to answer that. But Minette is more, ang pagtatae kasi side effect, maari, pero maari din siyang simptomas ng COVID. So, kailangan din natin malaman kung ano ang nangyayari, bakit nagtatae, no? Pag ganyang mga sitwasyon, kailangan magpa-check up pa rin, no? Kasi marami namang dahilan ng pagtatae. Doc Minette?
Yeah, agree po, Dr. Shelley. So, ang importante naman pag ganyan, ang side effect kasi sa bakuna, 1 to 2 days lang yan usually. So, importante kailan ba nangyari yung pagtatae. Kasi pag lumalagpas na dun sa expected natin na panahon na dapat nagre-react, kasi yung pagtatae sa bakuna or any drug, pwede siyang adverse event. So, kung lumagpas na siya doon, kailangan na imbestigahan na po, okay, kung bakit nagtatae yung pasyente. Katulad lang po ng pag masyado ng matagal yung lagnat dun sa panahon na nagbakuna po. Kasama po yan sa investigasyon na dapat nangyayari. Thank you.
Thank you po, Doc. Our next question po for Dr. Minette and Doc Shelley again. Kailan po ang vaccination ng mga bata na may comorbidities? Baka pwede rin po si Yusek Mirna later rejoinder. So, vaccination po sa mga batang may comorbidities.
Yung vaccination po for may comorbidities, alam ko meron na pong pag-uusap na pinapayagan na po na basta may comorbidity, isasama po yan. Kasi nga po, yung may comorbidity, yun po yung mas matindi po yung kurso ng sakit.
Alright, thank you po. Our next one, another comment. Yes, we need to prioritize our senior citizens and those with comorbidities. But are we also not supposed to protect the people around them, those caring for them? Nasagot na po to ni Yusek Mirna kanina about sa A2+1 at A3+1. For our medyo related po about... Yes po, Yusek Mirna.
In relation to the vaccination of children, there is already a consensus as of the moment. Pag muna tayong magbigay ng bakuna for those below 18 years old. No? while there are some cases na occurring, COVID cases below 18 years old, we are constrained, number one, by supply issues. Kailangan nakita naman natin, no, ang pinaka-importante, and we saw during this conversation, the prioritization framework. We go back to the health workers, we go back to the A2, we go back to the A3. And then, so aside, because of supply constraints, pangalawa, ongoing pa po yung mga studies, no, para sa bata. But we are not completely closing the door. Alam naman natin na marami sa mga nangyayari sa COVID ay work in progress. So as new things come up and mas firm up yung mga suggestions at saka recommendations from various trials and from various real world statistics, pagbibigay naman, they're open to giving the vaccines for children, but very much later. So we will wait for the recommendation from our all experts group, especially those from pediatric societies, kailan tayo pwedeng mag-start ng pagbabakuna sa below 18 years old. Thank you.
Thank you po. Our next question po, pwede for our NITAG experts. Tanong ko lang, ma'am, tapos na ako ng vaccination ng August 5. Tapos nagpa-swab ako sa private hospital ng Monday, August 9. Ang result daw po ay positive. I guess po ang concern dito ay parang breakthrough infections after vaccination po. Dr. Raminette?
Pero Dr. Casey, ang concern, parang are they asking ano nang gagawin or how do they proceed? Tama ba?
Yes po, and I guess kung gaano po ito kadalas na nangyayari.
Yung breakthrough infections, local studies, kung nabanggit niyo kung nakita niyo po yung sa PGH, they put out an initial findings but very small number of cases pa rin lang ang nababanggit doon. Mostly partially or not vaccinated din yun Ang concern dito would be on the 4th day. Importante kasi yung exposure risk din dun sa prior to the vaccination schedule. That would be my take. Before saying na it's an actual vaccine breakthrough infection. And usually when we say a vaccine breakthrough, dapat mas maganda sana fully vaccinated kasi siya to consider it as a post-vax breakthrough.
Dr. Casey?
Yes, Dr. Rabi?
If I understood the question, 4 days after the vaccine, that's not a breakthrough infection. The first dose of a vaccine will only give partial protection. Even after being fully vaccinated, it takes about 2 weeks for immunity to develop. So in between, if you have had infection either before your first dose or between your first and second dose, that cannot be considered a breakthrough infection. You need to wait for at least 2 weeks for full immunity levels to develop. It's only after that that you would then realize that somebody's got infected, because the incubation period you're looking at is about 14 days, so averaging 5 to 7 days, of course, but up to 14 days. And so if it's more than 14 days after the second dose, or if it's single dose vaccine after the single dose vaccine, then you would realize that infection has happened after that, and probably after the 14 days. And if the person still develops infection signs, that could be classified as a breakthrough infection. We are seeing some breakthrough infections with the vaccines, because as we've clarified from the beginning, what we know is that the vaccines are effective in preventing severe disease and death, right? But the latest studies coming out from the US and Israel shows that even against with the mRNA vaccines, you are seeing breakthrough infections, particularly with the Delta variant. So the efficacy, for example, from one study coming out of Israel shows that the efficacy of the Pfizer vaccine to prevent infection is about 63%. This is still being reviewed. We are looking at the data. But similar observations came from the Massachusetts study conducted by CDC in the US. About 76% of the people in Massachusetts, I think it was a sample of about 800 people who got infected, were vaccinated, fully vaccinated. So those are actual breakthrough infections. And it's important that when you see breakthrough infections, that we understand what is the virus that is causing the breakthrough infection. So what we are talking with the EB now is that if you are really seeing breakthrough infections, and when we say breakthrough infections, we mean what we just explained, then it's important that we try to do whole genome sequencing, because we need to understand what is the variant that is causing this breakthrough. That's important to understand which variants can cause breakthrough infections, and it's also important to understand which vaccines result in such breakthrough vaccines. So infection. So there are many reasons why we need to analyze these breakthrough infections, but we need to start by having a very clear understanding of what we mean by a breakthrough infection. Thank you.
Thank you, Dr. Rabi, for that clarification. So like what Dr. Rabi said, a fully vaccinated person would only be considered when it is already 2 weeks after the second dose or 2 weeks after the single dose vaccine. And even after the 2 weeks, we encourage everyone po na kailangan tuloy-tuloy pa rin ang pagsunod sa ating mga minimum public health standards. Dr. Rabi, I think this is partly about your presentation. This question is, why do we prioritize seniors and those with comorbidities when they don't even go out? Why can we not prioritize the economic workers who are always exposed outside? Dr. Rabi?
So we have seen several local government units that did this. And as I explained very clearly, it's the comorbid and the elderly who, when they contract infection, end up developing severe disease and dying. That is why we need to use the vaccines in the first place, to prioritize the elderly and the comorbid. Many of the workforce are younger. They are less susceptible to severe disease. And so we have not yet come across a country where they had to lock down the economy because young people were infected. They had to lock down the economies because hospitals were full, because hospitals couldn't manage the severe patients, because the healthcare workers couldn't manage it. They were exhausted. That's why we had to go to lockdowns. So if we are using the limited vaccines to vaccinate the workforce, it's not going to keep our economy open, because we're going to have to shut down when the hospitals are full. And so then we haven't made use of our vaccines rationally, right? So that is why we are saying prioritize the elderly. That way you'll reduce the number of severe cases. You'll reduce the overwhelming of the hospitals. You'll save more lives. That's the most important thing. And if you can do that, if you can keep the hospitals open, there's no need for a lockdown.
Thank you, Dr. Rabi. So, ayun, just to reiterate po ang sinabi ni Dr. Rabi, kailangan at mahalaga na bakunahan ng mga seniors at may comorbidities, kasi isa rin pong tulong para hindi ma-overwhelm ang mga ospital po natin sa ating mga localities. Now, this next question is from the DILG representative po natin for Dr. Shelley or Yusek Mirna. I presume the hesitance of some of the senior citizens to get vaccinated is psychological. Is there anything we could say to convince them to support or avail the vaccination program of the government? Dr. Shelley?
Well, psychological being fear. I'm not sure if that is the only reason, no? Psychological being the reason for vaccine hesitancy. I presented a slide based on our focus group discussions with senior citizens and other relevant stakeholders. And hindi po psychological ang dahilan kasi maaring ibig niyong sabihin po ay kakulangan sa kaalaman or lack of education or knowledge regarding the risks and benefits of vaccination. Maybe that's what you mean by psychological. Some people, though, are fearful of the needle, no? Maybe that is psychological. But most of the reasons for not getting the vaccine is outside of the psychological avenue in a way, no? It's how they access technology so that they can register, where they can go for registration, whether they can get the vaccine when they are in the vaccine center, and whether there is a support system within the barangay that allows them to access the vaccine. I think these are the more important environmental, in a way, reasons for not being vaccinated among senior citizens. So, but definitely we need to continue educating our senior citizens about the benefits of vaccination to their health and the health of the entire family and community.
Thank you po, Dr.
Yes,
Shelley. Yes, Dr. Rabi.
if I may add, yes, there is an important psychological element. There is, in a proportion of the elderly, there is that uncertainty, there is that fear. But if we look at it, actually we haven't really made an effort in many local government units to reach out to the elderly. All right, we need to recognize that where the local government units that reached 90-95% coverage among the elderly, they reached it because they made a special effort, right? They profile the elderly population. They use snowballing to find further who else is out there. You need to reach out to these people. They are not IT literate, a lot of them. They cannot register on the databases and they don't have that capacity. So we need to take that care. We need to remember that many of these people have been indoors to protect them for many months. So if you suddenly ask them to go to a vaccination site that is crowded and spend 4 hours, there are many people are going to be reluctant. So we need to create situations where they are comfortable to go and they can get the vaccine. It's not fair to expect a 70 or 75-year-old person to stay in a queue for 6 hours or 4 hours to get a vaccine, right? We have to create avenues for them to be able to access the vaccines. And we have success stories, LGUs that recognize this and set up mechanisms so that the elderly can access vaccines, that set up mechanisms to visit bedridden patients, have reached very high levels of coverage. We need to learn from our peers in this country how we can increase the coverage rather than saying, oh, there is a psychological issue. I'm not denying that there is in a very small proportion, but the bigger challenge is that we need to actually make a special effort to reach out to them. And if we do that, we find that a lot of them will accept. Another issue is that many elderly would, because they love their children and grandchildren, say, no, it's better for you to go and get it than me getting it. But what they don't realize is that when they get it, they're putting the whole family at risk. And also the terrible economic costs of when somebody goes into severe disease and goes into a hospital. That's a burden for the whole family. And the younger people will not end up in that situation. So we need to be able to clearly explain this to the elderly, that it's not only about their health and the economy, it's about even in the family, they need to realize that it's more important for them to take the vaccine, even though they want to give preference for their children and grandchildren because they love them. That's natural. But there is an element that because of that very love, they need to go and accept the vaccine.
May I add to that, Casey, that issue of allowing our senior citizens to know where and when they can receive the vaccine. Listing is a major problem because there are lists of, let's say, OSCA, that are not updated. And that has been a problem for this vaccination rollout. There are cities wherein their OSCA list has not been updated for many years. And this is where we need to rely on senior citizen organizations, no, and barangays, no. The actual barangay has to know who among their constituents are senior citizens who need to be vaccinated. Recently, I encountered a patient of mine who is a registered citizen of Manila, no? But because she had dementia, her children chose to transfer her to another city in the NCR so that they can take care of her during COVID. You know, they could not have her vaccinated because her name was in Metro Manila and the city where she is now does not list her as a member. But what will we do about this elderly in another, area of NCR? I think this is where the barangay has to really step in and advocate for that older person, even if they are not in their master list. No? Thank you.
Thank you po, Doc Shelly. So, ayun nga po, kailangan natin tularan yung mga magagandang example po sa iba't ibang mga LGUs gaya ng nasabi ni Dr. Rabi. So, yung iba, sinuyod talaga nila ang mga senior citizens at kinausap nila at dinala ang bakuna sa mga lolo't lola. Our next question po is for Yusek Mirna and I guess Dr. Rabi. Is there already a possibility for senior citizens to have a third dose of the vaccine? How true is this?
Yusek Mirna, is it okay if okay, I'll let you go first. Ladies first.
Go ahead. You go ahead. You're younger.
Thank you, ma'am. The absolute need for a booster is still being looked very carefully, right? We want to fully vaccinate everybody so that everybody has protection. We are not clear yet about the value add of a booster dose, whether it's from the same brand of vaccine that somebody received or from a different brand. This is something that WHO is working with our global team of experts to analyze and better understand what the actual value add is. With the mRNA vaccines, they've seen that the neutralizing antibodies concentration decreases after a specific period. And that's the rationale being used to advocate for a booster dose to increase the neutralizing antibodies. What is not clear is it only the neutralizing antibodies that give protection? And increasing the neutralizing antibodies, will it actually give enhanced protection? And for how long will that last? Once we understand this situation better, WHO will come out with a recommendation on the real need for a booster dose and what kind of protection a booster dose will offer. In the interim, you hear a lot of noise, but we are looking very clearly at what is the actual evidence, and we are advocating that we use the time in between to provide the opportunity to vaccinate as many people fully as possible before we start recommending booster doses. I hope that clarifies. Thank you.
Yusek Mirna.
I think I do not need to add anymore. I agree with the expert, WHO, Dr. Rabi. But be rest assured that we are looking into the possibility, but Dr. Rabi is correct. We should not divert our energies. Let us focus on vaccinating our citizens, starting with our A1, A2, and A3. That will come when it comes. Thank you.
Thank you po. Our last question is coming from one of our viewers from YouTube. This is for Dr. Minette. Ask ko lang po kung pwede kahit anong bakuna para sa taong may diabetes, coronary artery disease, at may allergies amoxicillin. Lahat po kasi yan ay nasa Mr. ko.
Okay. Good question. Marami pong may ganyang tanong. All the vaccines that are available in our country have been considered safe and effective for anyone po. Okay? Yun po yung tatandaan nyo. So, kung na hindi pa kayo napaparehistro, magparehistro na po. Magpabakuna po kayo.
Alright. Maraming salamat po. Ngayon po, bago tayo magtapos, maaari po ba kami humingi ng mga short messages from our experts na kasama po natin ngayon? Dr. Rabi, can we ask for a short closing message from you?
Thank you, Casey. I think this is a good opportunity for us to understand that the responsibility of maximizing the response lies with each one of us, whether we are from the health sector, whether we are from the local government units, or whether we as individuals, as family members, we all need to do what we need to do. The arrival and the local transmission of Delta variant reinforces that there is no quick way out of this pandemic. Yes, the vaccines will be helpful, but we still need to follow the minimum public health standards. We need to follow the masking. We need to do the hand hygiene. We need to avoid crowded, closed settings. If we continue to do that, we add value to the vaccine administration we are doing. And while we do that, let's emphasize that we make the most of the limited vaccines that are available by following the prioritization. And that, again, is the responsibility of everybody. It's not just the staff at the vaccination site or the RVOC or the NVOC. It's also the responsibility of the local governments, the local chief executives, to ensure that the elderly, the comorbid, can access the vaccines. So it's all everybody's responsibility to maximize what we have and to do what we need to do to protect ourselves and our loved ones. Thank you.
Thank you, Dr. Rabi. Next po, Dr. Shelley.
Thank you very much. Aside from what was already emphasized by Dr. Rabi, let's not forget that healthy aging is here to stay. We need to target that, and we cannot forget the rest of our health. And it takes really a good program in the barangay level, no? Even within families, to help support that older person who needs that vaccine. So let's make sure, first of all, that we do get our regular checkup, senior citizens, no? Take your maintenance medicines, and pag hindi pa po nakapagpabakuna ay magpalista na, kausapin niyo po yung tauhan sa barangay na in charge sa pagpapaschedule, sapagkat napaka-importante po talaga ng kaugnayan ng isang senior citizen at pamilya sa kanyang barangay. Kayo po talaga ang napaka-importante para hanapin ang senior citizen na hindi pa nagpapabakuna at paano madala ang bakuna sa kanya. So let's all work together. Apat dapat syempre, face mask, face shield, hand washing, so physical distancing, pero always healthy aging kasi matatapos din ang COVID. Salamat po.
Thank you po, Dr. Shelley. Now, a short message from Dr. Raminette.
Thank you. All vaccines available in the country are effective and safe. We should be united in our message for advocating for vaccination, not only for COVID vaccines, but also for non-COVID vaccines. And also, vaccination po is only one of the several measures that we need to fight against this pandemic. Thank you po.
Salamat po, Dr. Raminette. Another short message po from our spokesperson, Dr. Yusek Rosette.
Yes, gusto ko lang magpasalamat sa inyong lahat. Kayo po ay dumalo dito po sa ating pagtitipon. I'd like to say thank you to all of our resource persons, Dr. Rabi, Dr. Shelley, and Dr. Minette for joining us today. Sana po na ipahatid namin sa inyong lahat ang pinaka-importanting mensahe namin ngayong town hall na ito, ang atin pong mga lolo at lola, ang mga senior citizens, and those with comorbidities ay mataas po ang risk, lalong-lalo na po ngayon na meron tayong variants of concern. So this is the main reason kung bakit po kami ay nagpapabalik-balik sa inyong lahat para i-encourage kayo at ang ating mga kasamahan sa A2 and A3 na sana po sila po ay magpabakuna na. So do our minimum public health standards plus vaccines, kayang-kaya po nating labanan ang kahit na anong variant of concern dito po sa ating bansa. Salamat, Casey.
Thank you po, Yusek. At ngayon po, sa pagtatapos ng ating programa ngayong umaga, ating pakinggan ang mensahe ng Chairman ng National Vaccination Operations Center Against COVID, our Undersecretary of Health for FICT, Yusek Myrna C. Cabotaje. Yusek.
Salamat, Casey. Magandang umaga po sa inyong lahat. Salamat sa pagdalo natin. I will second the thank you of Yusek Rosette to our resource persons. Dr. Rabi really took time out to emphasize the importance of A2 and A3 vaccination. Salamat, Dr. Shelley and Dr. Minette, for giving us the significance of the prioritization framework and how it affects the mortality and the morbidity from COVID-19. Also the current vaccination coverage of our priority groups, A2 and A3, and the importance of vaccinating our elderly and those with comorbidities. Thank you, Dr. Rabi, Dr. Shelley, and Dr. Minette for gracing us today with your expertise. Tatlong paray lang ang take-home message ko sa ating lahat. Number one, why do we prioritize? Because we have limited supply. If we do not have limited supply, we can give everybody anytime. And because of this prioritization, there is this group of experts who recommended, based on their knowledge and experience, that we start with our health workers. Hindi ho tayo nagkamali doon. So we have vaccinated almost 90% of our health workers with their second doses fully covered. So there are less and less health workers who are sick. And we are more confident. Pangalawa, why do we need the senior citizens? And comorbids? Because they protect by vaccinating them, we protect our economy. Sabi nga ni Dr. Rabi, we prevent increase in hospitalization, serious illnesses, and we prevent overwhelming the health system. Kaya pulo. And then we can prevent the lockdowns. And if we can prevent the lockdowns that are continuously being made, then we can prevent economic downturn. So may importansya po yung ating prioritization. Why do we prioritize? Pangalawa, I'd like to capitalize on what Dr. Rabi said. It is that we need to reach out to these A2 and A3. How? By information. We need to tell them why they need to be vaccinated. Maybe Dr. Minette has also mentioned, mali kasi ang akala ng iba, kasi may comorbid, dapat hindi magpabakuna. All the more, pag comorbid ka, you're posing a risk to yourself and hospitalization, etc. The more you need to be vaccinated. But then, kailangan din may guidance ng inyong doktor. So that walang absolute contraindication ang those comorbidities. So aside from information, and sabi nga ni Dr. Rabi, we are all accountable and responsible for this information. Also physically reaching out. Marami sa ating mga senior citizens, hindi na tech-savvy, they do not go out of the house. So marami na rin good practices, Mandaluyong for instance, nagsuyod. They're doing vaccination of those who are bedridden. And now we're coming up with the policy of A2 and A3+1 para lalong maengganyo yung ating mga senior citizens to come out and be vaccinated. Reaching out is also providing the prioritization, yung ating mga different strategies, mga buses, mga mobile vaccination centers. We try to bring the vaccination to where the senior citizens are. And then pangatlo, even in ECQ, all the more we should have this time of ECQ when we can have more time to prioritize our A2 and A3. Tuloy-tuloy po ang pagbabakuna. We have reached about 24-25 million, but that is not enough. Kahit na may favorite line, binakunahan po natin lahat ng A4. Pag hindi po natin binakunahan yung ating A2 and A3, we will continue to overwhelm our health system. So let us prioritize. Let us continue to give information and practice yung sinabi ni Yusek Rosette and Dr. Rabi. The vaccination is only one arsenal. Let us continue to have and practice minimum public health standards, yung face mask, face shield, distancing, ventilation, and most important, no, kahit na ikaw ay vaccinated, you should also practice all these minimum public health standards. Maraming salamat, and we hope you will be our multipliers in convincing and in reaching out to our senior citizens and those who are responsible for having them vaccinated. Maraming salamat po.
Thank you, Yusek Mirna, at maraming salamat po sa lahat ng mga CHD officers and staff, mga LGUs na kasama po natin dito. Tulong-tulong po tayo na mabakunahan ang ating mga A2 at A3. Maraming salamat po. Good morning.
Morning, thank you.
Thank you very much.
Thank you, Dr. Rabi.
Pang karamdaman, magparehistro na para sa bakuna kontra COVID-19.
Lolo, Lola, isang taon na tayong nahiwalay dahil sa quarantine. Miss na po namin kayo. At ang inyong masasarap na luto at pag-aalaga. May bakuna na raw po sa COVID-19. Kunin niyo po Kapag nabakunahan na ang lahat, makakapiling na muli namin kayo.
Kung ikaw ay edad 60 pataas o may iba pang karamdaman, magparehistro na para sa bakuna kontra COVID-19.